Okay, so it gives me great pleasure today to introduce Professor David Rowitch, who's kindly agreed to be our keynote speaker today. Um, Many thanks for joining us, Professor Rowitch. If you can, if you could just give a brief introduction to your work and your role.
Thanks, Dr. Marlowe. I'm David Rowitch. I'm Professor of Pediatrics at University of Cambridge and also Director of Research at Cedars-Sinai in Los Angeles. And I've been involved for several years in directing research in pediatrics across the East of England region.
And thank you. And my first question, and for the audience, is looking at currently at the NHS 10-year forward plan, and understanding that genetics and genomic medicine is at a central part of that. To give your view on the future of why it's important and the way that genomics within the NHS is going to move in the future.
Yes, thanks. So it's a terribly important new tool that we have and a challenge to embed genetics and genomics. That is taking stock of all of the DNA sequences that are the blueprint for development, but also can encode vulnerabilities to disease. How do we embed this very complex information, 64 billion base pairs of DNA, which is kind of what comprises your genome, into healthcare? As you can tell from my accent, I'm from the United States and came to England about 10 years ago because it was clear the NHS was aiming to be the first national health system in the world to embed those tools to provide new insights into healthcare. What does that mean? There may be particular diseases caused by genetic mutations, which would result maybe in a developmental disorder or a congenital anomaly like a limb malformation. It could also be that we have in that information vulnerabilities to chronic diseases like kidney disease or diabetes, which could occur many years or decades later. And it also can determine maybe our response to medications. Why do some people have worse side effects than others? Why do some medications work for some versus others? And when we start to think about all of these various applications, it's a big task. It really does need to be addressed at a national scale. It does need to be extended across populations to really understand how genetics can be used to better inform care of individuals. And of course, in pediatrics, terribly important to get it right around the time of birth to understand how that information can inform healthcare because we want to do the best for children, especially in the formative years of 0 to 5. So these were some of the, interesting, important kind of ways that we can use genomics. And the 10-year plan of the NHS was the first that I saw globally to embrace those ambitions and say, this is the time now to implement this for healthcare across the nation. So the NHS 10-year plan will reflect some of those ambitions. How do we use genetics to better our understanding of cancer and its treatment, maybe heart disease, but also, and importantly, during early years development in the womb and around the time of birth and in the formative years of development for children.
Thank you. The other aspect of today is to thank you on behalf of ESNEFT for all the support you've offered over the last 3 years for both myself, the SANUP Centre, and the ambitions of our trust clinically. It's been hugely supportive. And I suppose the question is for you is why ESNEFT and the importance of I suppose spreading information around genetics and away from the more tertiary centre work.
Right. So based in Cambridge, I've, grown up in, I guess the mythology and the legends of DNA discoveries. Of course, people in the UK should recognize that many of the important discoveries around DNA were made in the East of England, at the Wellcome Sanger Institute and the University of Cambridge. The discovery of DNA structure, how to sequence it, how to now do that at a more practical level by having companies like Solexa and Illumina that can provide DNA sequencing. All of that has happened sort of in the backyard or in the East of England region. And so to see how studies typically then translate into impact we would expect the research to start in Cambridge, but then it does need to extend across the entire nation. So as a director of the Cambridge Biomedical Research Center theme for pediatrics and women's health, which I led for the past 5 years, it was very important for me to make sure that these tools and that access to research could extend across the east of England. And Colchester was a perfect site because of the Synapse Center and a interest to explore how these tools could be helpful. So as part of the Biomedical Research Center funding from the National Institute for Health Research, we extended our research studies to Colchester, and that resulted in, I think, some really remarkable uptake and interest in how genomics could be, helpful in providing diagnosis and maybe informing personalized care. That now I would just have to say, Dr. Marlowe, that ESNEFT has taken on his life of its own, because the enthusiasm and the commitment that leadership has shown has been remarkable, and seeing very quickly how those benefits could be extended within the trust is something that I've been very happy to see. So now I think the trust has become much more enthusiastic about having a genomics program across the entire trust and across the life course, so that adult genetics that can affect cardiovascular disease risk, cancer genetics, and so on will also be part of the scope of what is developing there. So again, it's been very interesting for me to see how, starting with a bit of funding and support from Cambridge, ESNEF has really sort of taken the ball and run with it.
And thank you very much. I think coinciding now with the launch of Epic and a chance to innovate with data, I think this is a really good time to be involved with genomics, and the audience that we have here today, I'm hopeful will, whether they're the start of their genetics journey in terms of their interest, will see it as important to engage and get involved with our work within the trust. But many thanks for your time, Professor Rowitch. As I said, it's been great to have your support over the last few years.
Thanks, Dr. Marlowe, and thanks to all the families who participated in the research.